think about the last shower you took. Really think about it. The warm water, the steam, the moment you stepped out and reached for your towel. Now ask yourself this. Did you feel a little dizzy? A little breathless? Did your heart do something strange just for a second that you brushed off and forgot about by the time you got dressed? Because here's what I want you to understand before we go any further. Nearly 40% of adults over 60 experience a significant cardiovascular event that is directly preceded by exactly that kind of moment, and the vast majority of them never connected the dots. Not because they weren't paying attention, but because nobody ever told them what they were actually feeling, or why a simple daily routine like stepping out of the shower could be the moment your body is trying to send you the most urgent message it knows how. And this is where the system tends to fall short, not because doctors don't care, but because a routine checkup covers blood pressure, cholesterol, medications, and there's simply not enough time left in that appointment to walk someone through the cardiovascular changes that happen during and after bathing. It doesn't make the priority list. So people go home not knowing, and they keep brushing off the dizzy spell, the racing heart, the strange heaviness in the chest, because nobody told them those moments matter. Here's what's actually going on. When you step into a warm or hot shower, your blood vessels dilate. They open up and widen, which means your heart has to work significantly harder to maintain adequate blood pressure throughout your entire body. That's already a meaningful physiological challenge. But the moment you step out of that shower, something shifts. The warmth disappears, the body has to rapidly readjust. And for people over 60, whose vascular system and autonomic nervous response are both working differently than they were at 40, that readjustment doesn't happen as smoothly or as quickly as it once did. The result is a window of cardiovascular vulnerability that can last anywhere from 30 seconds to several minutes. And during that window, certain symptoms are not just uncomfortable. They are warning signs that deserve your full attention. I'm Dr. Ben Walker, and I've spent over 20 years focusing on internal medicine and preventive health, specifically the ways aging changes the body's response to everyday situations that most people never think twice about. What I want to walk you through today is something the research on this has been quite clear about for years, and yet it rarely reaches the people who need it most. In this video, I'm going to walk you through 8 warning signs to watch for right after you shower, and I'm saving the last one for the end, because it's the one that consistently surprises people the most, and it's also the one most commonly dismissed as nothing. Before we get into it, drop your age in the comments and tell me whether you've ever felt dizzy or lightheaded right after a shower, even once, because what you share down there is going to shape what I cover in upcoming videos. And if this is the kind of content that feels genuinely useful to you, a quick like really does help me keep making it. Now, let me give you the foundation you need to understand why this matters so deeply for people in this age group specifically. Your cardiovascular system, your heart, your arteries, your veins, and the nervous system that controls them is not operating in isolation. It's constantly receiving signals and making micro adjustments to keep blood pressure stable, to make sure your brain is getting oxygen, and to ensure that when you change positions or environments, nothing dangerous happens. This process is called autonomic regulation, which simply means your body's automatic adjustment system. In younger adults, this system is fast, responsive, and precise. But after 60, research consistently shows that this automatic system becomes slower and less precise. It responds to the same challenges, but it takes longer to catch up, and the margin for error narrows. So when something like a hot shower dilates every major blood vessel in your body, and then the heat source suddenly disappears, that narrower margin for error becomes genuinely significant. Some people will experience this daily and never have a problem. Others will experience it and find that it's their body flagging something that needs attention. And the only way to know the difference is to understand what you're looking for. So with that in mind, let me walk you through the 8 warning signs I want you to know about. These aren't ranked in any particular order because what matters most will depend entirely on your individual health situation. So what I want you to do is listen through all of them, because more than one may apply to you, and sometimes it's the combination that carries the most meaning. Number 1 is sudden dizziness or lightheadedness the moment you step out of the shower. This is the most common one, and because of that, it's also the most commonly dismissed. A lot of people think it's just about getting up too fast or not drinking enough water. And while both of those things can contribute, what's happening here is more specific than that. When your blood vessels are maximally dilated from the heat, and then the heat is removed, your body needs to rapidly redirect blood back upward towards your brain and heart. If your autonomic nervous system doesn't respond quickly enough, your brain experiences a brief drop in perfusion, which simply means blood flow. And that's when you feel that sudden wave of dizziness or that floaty, off-balance sensation. For people over 60, this particular mechanism is worth paying attention to because it can reflect how well the heart and vascular system are managing pressure changes overall. And research suggests that recurrent episodes of this kind are associated with an increased risk of falls, and in certain cases with underlying cardiovascular changes that are worth investigating. A patient I want to tell you about is a woman named Margaret from Phoenix, a retired school teacher in her late 60s who had been experiencing this almost every morning for 2 years and simply accepted it as part of getting older. It was her daughter who finally brought it up with her cardiologist, who discovered that Margaret had been experiencing consistent drops in blood pressure during position changes, a condition called orthostatic hypotension, which had been quietly putting strain on her heart for months. If this is happening to you regularly, please mention it at your next appointment. Don't wait for someone else to notice. Number 2 is heart palpitations in the minutes after your shower ends. Now, most people know what a palpitation feels like, that fluttering, that skipped beat, or sometimes a sudden pounding that makes you pause and press your hand to your chest. The question is whether what you're experiencing is a benign blip or something worth tracking. What's happening here is that the rapid vascular changes during a hot shower create a temporary spike in demand on the heart, and for some people, especially those with any underlying arrhythmia or electrical sensitivity, this can trigger an irregular heartbeat. Research suggests that hot water immersion and temperature change are known triggers for certain types of cardiac arrhythmias, including atrial fibrillation, which simply means an irregular, often fast heart rhythm that can, if undetected or untreated, significantly increase the risk of stroke. A man named Robert from Nashville, a retired contractor in his early 70s, described feeling what he called a flapping in his chest every time he got out of the shower, usually lasting less than a minute. He'd lived with it for years until a routine monitoring device caught recurrent episodes of atrial fibrillation that his cardiologist was then able to treat. The takeaway here is simple. If palpitations after your shower are happening more than occasionally, they deserve documentation. Write down when it happens, how long it lasts, and what it feels like, and bring that information to your doctor. Number 3 is a feeling of unusual shortness of breath that comes on right after you step out. Not the normal breathlessness of getting out of a steamy room, but a sense that breathing requires more effort than it should, or that you need to sit down to catch your breath, even though you haven't exerted yourself. The reason this matters for people over 60 is that the heart, when it's working harder than usual to compensate for the vascular changes of a hot shower, may temporarily produce a backup of pressure that affects the lungs, a mechanism associated with heart failure, which simply means the heart isn't pumping with full efficiency. This doesn't mean that everyone who gets a little breathless after a shower has heart failure, but what research does show is that exertional or post-activity shortness of breath, even when the activity is something as mild as a shower, is one of the more reliable early warning signals for this condition. And it's one that is frequently missed because people don't think of a shower as a physical stressor. A woman named Linda from Portland described it as feeling like someone was sitting on her chest for a few minutes every morning after she bathed, and she had been waving it off as anxiety. When her doctor ordered a cardiac ultrasound based on that description alone, it revealed significant changes to her heart's pumping function that she hadn't been aware of. Please don't minimize this one. Even if it feels minor, mention it. We're about halfway through now, and the next few are the ones I really want you to pay close attention to, because they tend to be the most underreported and the most significant. Number 4 is sudden fatigue, or a heavy, drained feeling right after your shower that takes a long time to lift. Not general morning tiredness. This is a specific, disproportionate exhaustion that sets in the moment you finish your shower and lingers for 10, 20, even 30 minutes afterward. What's happening here is that the cardiovascular effort of managing a hot shower can, for a struggling heart or a significantly compromised vascular system, genuinely deplete short-term cardiac output, meaning the heart has been working hard enough that it needs a meaningful recovery period for something that shouldn't require recovery at all. Research into cardiac reserve capacity, which simply means how much effort your heart has in reserve beyond what's needed for basic rest, suggests that this kind of post-minimal activity fatigue is an important clinical marker, and one of the early ones, for declining cardiac function. A man named James from Cleveland told his doctor that he'd started needing to sit on the edge of the bed for 15 minutes after every shower because he felt too exhausted to stand and dry off. That description led to a stress test that revealed significant coronary artery changes. If your shower is leaving you needing to recover, your body is telling you something worth listening to. Number 5 is a cold sweat immediately after stepping out of the shower, when the room itself isn't particularly cold. This one is particularly important, and most people either don't notice it or attribute it to humidity in the bathroom. But a cold or clammy sweat that appears quickly after a temperature change, especially when paired with any other symptom on this list, is one of the classic signs the body uses when it's under cardiovascular stress. The nervous system, when it detects inadequate blood pressure or cardiac output, triggers a stress response that includes sweating and pale or clammy skin as it tries to redirect blood to vital organs. For anyone over 60, this is especially relevant because the threshold at which this stress response kicks in can be lower than it once was, meaning it doesn't take as much to trigger it. A woman named Dorothy from Denver described always feeling strangely cold and sweaty after her morning shower, despite feeling fine during it, and it was her husband who noticed she also looked pale in those minutes. Her cardiologist confirmed she had been experiencing recurrent episodes of vasovagal response, which simply means her nervous system was over-triggering a blood pressure drop that were significant enough to need attention and management. I want to pause here for a second and ask you something. Have you experienced any of the symptoms we've talked about so far, even once? Drop it in the comments, yes or no, because I genuinely want to know how many people watching this have been living with one of these and never had it looked at. It helps me understand what to cover next. Number 6 is chest tightness, pressure, or a squeezing sensation in the minutes right after your shower. I want to be very clear here. Any chest discomfort that is new, unusual, or persistent warrants immediate medical evaluation. I'm not going to soften that message. But what I want to explain is why the shower specifically can be a trigger for this. When the heart is working against a dilated vascular system, the coronary arteries, the ones that supply the heart muscle itself with blood, can experience relative underperfusion, which simply means the heart muscle is briefly getting less oxygen than it needs. For anyone with any degree of coronary artery disease, which research suggests affects a significant majority of adults over 65 to some degree, even without a formal diagnosis, this temporary oxygen gap can produce chest symptoms. A retired firefighter named Harold from Tampa described a heaviness across his chest that he noticed specifically after hot showers, which he'd been attributing to heartburn for almost a year. A cardiac workup revealed significant narrowing in a major coronary artery that was highly treatable, precisely because it was caught early. Please, if you are experiencing any chest symptoms after your shower, even ones that feel mild or that pass quickly, speak with your doctor about this specifically. Tell them about the timing. It matters. Number 7 is visual disturbances in the moments after stepping out. Things like spots in your vision, narrowing of your visual field, a sense that things look brighter or darker than they should, or a brief moment where your vision simply goes grainy or unclear. This one tends to alarm people significantly in the moment and then get rationalized quickly as the steam or moving too fast. And while the steam can certainly make a bathroom hazy, actual visual changes in your field of vision are happening inside your eye or your brain, not because the room is foggy. What's happening here is closely related to the blood pressure and cerebral perfusion mechanism we discussed with dizziness. When the brain gets a brief reduction in blood flow, the visual cortex is often the first area to show signs of it, because it's among the most oxygen sensitive. Recurrent visual disturbances with position changes or after cardiovascular stress are a recognized warning sign for transient ischemic attacks, which are often called mini strokes, and they deserve medical evaluation. A woman named Carol from Minneapolis described seeing little white sparks at the edge of her vision every time she stepped out of the shower, and she'd been laughing it off for months. Her neurologist and cardiologist, working together, identified a significant carotid artery narrowing that was putting her at real risk. Don't laugh this one off. Number 8, and this is the one I promised to save for last because it's the one that almost nobody expects, is a sudden, unexplained feeling of anxiety, dread, or a sense that something is deeply wrong without any obvious emotional trigger in the moments right after your shower. Now, I want to be thoughtful about this one because emotions and physical sensations are deeply connected, and this is not meant to cause alarm. But here's what the research actually shows that most people don't know. One of the recognized symptoms of significant cardiac events, including heart attacks that are in the early stages, is a sudden, overwhelming sense of doom or dread, a feeling that is not psychological in origin, but is actually the body's neurological alarm system firing in response to what the heart is experiencing. This has been documented extensively in cardiac literature, and it occurs in both men and women, though it's particularly underreported in women because it gets attributed to anxiety or emotion, rather than being taken seriously as a cardiac signal. A man named George from Austin described the morning before he was diagnosed with a significant cardiac event as feeling like something invisible was very wrong the moment he stepped out of his shower, and he'd had that feeling several times in the preceding weeks without being able to explain it. That feeling was his body's most sophisticated warning system, doing exactly what it was designed to do. If you experience this, especially if it is paired with any other symptom on this list, please seek medical evaluation, because that feeling is your body speaking clearly, and it deserves to be heard. Now, I want to take a few minutes and talk about what to actually do with all of this, because information without direction doesn't serve you. The first thing I want you to do, today or this week, is to start making a simple note on your phone every time you finish a shower and experience anything that feels off. It doesn't need to be elaborate. Just the time, a brief description of what you felt, and how long it lasted. That information is extraordinarily valuable to a doctor because it transforms a vague complaint into a documented pattern, and documented patterns lead to answers. The second thing I want you to do within the next month is to bring this specific topic up at your next medical appointment. I want to talk about how I feel right after my shower. I've noticed, ask your doctor whether it's worth checking your orthostatic blood pressure, which simply means your blood pressure is measured while lying down and then immediately upon standing, because that single test can reveal a great deal about how your vascular system is managing these kinds of transitions. And in the meantime, there are some practical adjustments that many people find helpful. Lowering your shower temperature slightly, sitting down for a minute after you finish before standing fully, and making sure you're well hydrated before you bathe. None of these replace medical evaluation, but they can reduce the intensity of the physiological challenge while you gather more information. And as always, please speak with your own doctor before making any significant changes to your routine, especially if you are managing other health conditions or taking medications that affect your blood pressure or heart rate. Here's what I want you to carry with you from this video. The human body, even after 60, is remarkably communicative. It sends signals constantly, and it rarely stops sending them until something forces it to. What often goes wrong is not that the body stops warning us, but that we learn to tune out the signals because nobody told us they mattered. A dizzy moment after a shower, a racing heart, a heaviness in the chest, a strange feeling of dread. These are not random. They are not just aging. They are a language, and now you know how to read a little more of it. 60 is not the end of the story. In many ways, it's the moment when the information you act on matters the most, because the choices you make and the signals you respond to in this chapter of life carry enormous weight for the chapters that follow. And your body is still worth fighting for. That's what I believe, and it's why I keep making these videos. If you found this helpful, please consider subscribing to the channel. It's the best way to make sure you don't miss future videos. And if this is something that someone you care about needs to hear, share it with them. I'll see you in the next one.